The highly infectious Delta variant ignited surges of COVID-19 cases in Hawaii, sending hospitals into crisis mode. It also intensified the fierce debate over vaccines. And with confusion over new mandates, questions about booster shots, and a new variant detected, many just want to know if it will ever end. We're talking with health and data experts to see if it's too soon to tell. Tonight's live broadcast and live stream of insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Daryl Huff. In recent weeks, Hawaii's COVID case numbers skyrocketed to levels we've not experienced. Health officials say the majority of cases that result in hospitalization are patients who are unvaccinated. But there are breakthrough cases among fully vaccinated residents as well. The reality is vaccines are not bulletproof, but health experts say they greatly lower a person's chance of getting severely ill or dying. Your vaccination status is also becoming increasingly important with more government and employer mandates rolling out. And according to the State Health Department, there are more than 141,000 eligible residents who have not gotten the shots for a variety of reasons. With the Delta variant changing the odds, our panel tonight will discuss the collective struggle to fight the virus. We look forward to your participation in tonight's show. You can email or call in your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. Now to our guests. Republican State Senator Kurt Favela is a lifelong resident of Ewa Beach and is a Campbell High School grad. He represents District 19, which includes communities in Ewa Beach, Ocean Point, Ewa by Gentry, and Iroquois Point. Hilton Rathel is the president and CEO of the Healthcare Association of Hawaii. The organization represents 170 healthcare organizations, including hospitals, skilled nursing and assisted living facilities, and hospices. Monique Chiba is a mathematics professor at the University of Hawaii at Manoa. She's also a volunteer with the Hawaii Pandemic Applied Modeling Working Group, which is working to increase scientific understanding of COVID-19 within the state. And Kenny Akamu is a crisis nurse at the Queens Medical Center West on Oahu and at Kaiser Medical Center. In his position, he oversees all of the patients at the hospital. He has more than 30 years of nursing experience, ranging from neuro, cardiac, and medical ICUs. Kenny, you're on the front lines of this battle. Tell me what it's like in the hospitals right now for you and for your colleagues trying to take care of people.
It's been really busy, I can tell you that for one thing. I mean, it's unbelievable how many patients are in the hospital that cannot breathe. And it's really sad because, I mean, when you look at this person gasping for air, he can be gasping for air for like one whole week before we finally decide on maybe intubating him and putting him on the ventilator. And it's really frustrating. There's a lot of times we're looking at each other and we're going, God, 2 injections would have prevented all of this from happening. And you look at the patient's face and they got this really scared look on their face and like they're afraid that they're gonna die. And they get the same look. They get that look like, damn, I should have put those 2 simple injections. And it's crazy. I mean, 2 simple injections and a lot of people are making it like they're cutting off their arm or something. I don't know, it's getting ridiculous.
You know, Hilton Rathel for the Hospital Association, we have a graphic up right now that describes the Queens Health System's current situation. This is statewide with 94 hospitalized with COVID, 12 fully vaccinated, 82 not vaccinated, 24 in their ICUs, 3 fully vaccinated, 21 not vaccinated, 21 on ventilators, 2 fully vaccinated, 19 not vaccinated. Hilton, do these numbers that Queens is seeing, is that reflected across our healthcare system?
We're seeing those numbers very consistently across our system. What we have been experiencing throughout this surge, which has been devastating for our community, is that somewhere in between probably 87 to 88% of the COVID hospitalizations are unvaccinated. So that's, it's almost 90%. When we started off this surge, about 95% of the patients, our hospitalized patients, were unvaccinated. But then as the Delta variant spread more into the community, it impacted more of the vaccinated individuals. But even as recently as yesterday, 88% of our hospitalized patients, COVID hospitalized patients yesterday, were unvaccinated. So the numbers you're seeing there for Queens are very consistent across the entire state.
And then Monique Chiba, you folks actually try and estimate where COVID is going. At this stage, what are you guys looking ahead to seeing in terms of the future of this virus? And I understand your models take into account the current situation of mandates and travel and all those other sorts of things, right?
Yeah, so in early August, we forecasted that big surge that was with no indication of the future mitigation that would come. But then the mitigation came, and now, like everybody can see on the data, on the numbers, we're trending down. The big question and what we're looking at now is how are we trending down, how fast are we trending down, and how low we're going to go, because this is going to determine the future and how the mitigation can be lifted. Those are really the question that we have now, rather than numbers in stone. It's really to try to find the rate at which things are changing, and if they're going to plateau. We've seen on other countries, they go down and they plateau, and they go up, or they plateau too high, and this is what we want to avoid.
Senator Favela, let's talk a little bit about your community of Eva Beach. How has COVID affected your community in general? I mean, it had a fairly low vaccination rate for a while, but I think you folks have managed to bring it up some.
Yeah, I think it was just more for in Eva Beach area was accessibility. We have a lot of family members that catch bus transportation, public transportation to go to work and go anywhere. Having it at Queens Hospital is good for people that has cars. It wasn't good for people that don't have cars. So that's the reason why we try to take the grassroots effect and try to bring it into the communities, more into the parks, next to the schools, the community centers, just to have more accessibility. And that's what we've been asking our mayor and our governor to help us with in pushing this vaccine, rallying to educate and put more shots in arms.
You know, Kenny Akabu and I think perhaps Hilton on this one too, have we gotten better at treating people? I mean, I know we're certainly better than we were at the beginning, but when someone comes in and they're hospitalized, are they more likely to survive now than they were, say, a year ago? Ken?
You know, when it first came out, the statistics I recall was like, for a patient who goes onto the ventilator, it was like almost like an 80% mortality in the beginning of this disease. And then they came up with remdesivir and steroids, and I think they're treating it better. And I think lately the statistics was, if you're on a ventilator, it's something more like 35% mortality. So it looks like it's gotten better. I think I'd like to bring up about those statistics though, like all those patients on ventilators. I mean, two of them was unvaccinated. Two of them was vaccinated, and yeah, that's really unusual to see a ventilated patient vaccinated. A ventilated patient that was actually vaccinated.
Yeah. So yeah, Hilton, are you seeing that people are not as likely to die once they go to the hospital now?
Absolutely. As Kay just mentioned, the treatments have gotten much better. This is a brand new disease, and so it took quite a while to figure out what was the best course of action. And things like proning, for example, well, it took a little while to figure that out. Whether or not people should be put on ventilators, or if they should be put on ventilators, when should they be put on ventilators? The use of remdesivir, for example, that Kenny mentioned, has been pivotal in terms of helping people who are in our hospitals. So our survival rate has certainly gotten a lot better. But what has also happened is that, fortunately, the overwhelming majority of individuals who are elderly and who have chronic conditions have been vaccinated. And so very early on in the pandemic, before we had vaccinations, we had a lot of people who were older and who had chronic conditions who were dying. So the death rate was certainly much higher. Now, because many of them are vaccinated, what we're seeing in the hospitals is we're seeing 20-year-olds, 30-year-olds, 40-year-olds, 50-year-olds in the hospital. And unfortunately, some of those are dying because they are unvaccinated.
You know, Monique Chiba, in your projections, did you ever do a projection back before we had vaccination? Like, could you tell me if we had not had the vaccination process begin when it did, what the condition would be of this pandemic at this stage?
Yeah, we did that. We did try. So we did two different things regarding the vaccination. So one of it was just withdraw the vaccination and keep the course. And the Delta variant would have really skyrocketed the cases to a catastrophic level. It was the venue of the Delta variant would have put us in a complete crisis, completely alarming, and it would have been completely out of control, I'm sorry. Then we did another simulation where we just took off the fact that the vaccination is protecting against symptoms and severe symptoms, but it's still protecting transmission. It's reducing transmission. In that case, the daily cases would not skyrocket as if no vaccination. However, the hospital would double. So having the vaccination being able to really alleviate the severe cases is even now putting us in a much better position than it would have done.
Can I ask you, Kenny Akabu, as a nurse, Hilton mentioned that you're seeing younger and younger people come in. You may be better at treating them, but what I'm wondering about is the Delta variant, people who have the Delta variant, do the course of their illness, is it different? I was hearing that you get sicker a lot, you get sick faster, and you are sick longer. Is that what you've noticed about it?
Hard to say, because I think the main thing I got out of what he said was that I think most of the older folks are vaccinated. So now we're looking at a different population that's unvaccinated, that's populating the hospital, and so they've got stronger bodies to actually fight this disease. So they might be hospitalized. I've seen patients who've been in the hospital for like 1 month, and that's why I think that's why the course of the illness is longer, because they're fighting it for 1 month. Just when in the beginning of the disease, the older folks would probably die much faster than being in the hospital for 1 month.
Oh, that's a big difference, right? Because if you've got a younger population, they're gonna handle the disease much differently than the older population that was originally getting hit before. What's your advice to younger people, though? There's a lot of people are just like, they feel invincible.
My advice, is simple. I mean, you guys, I'm not a politician, so I don't have to be nice. I can just say how I feel. I mean, just don't get silly and just get an injection, because thinking about it a little bit too much. I mean, it's ridiculous. Just get the injection. I mean, my 14-year-old daughter can get the injection. You can get the injection. I mean, you cannot just ride the coattails of all of the people who are sacrificing themselves and getting the injection. Then you think, okay, if everybody gets the injection, I don't have to. No way.
Hey, Kurt,
Senator, you might get sick longer.
Senator Favela, you deal a lot with vaccine resistors in your district. What do you say to people who come to you and say something about the vaccine and I don't want to get it? What do you say to people? How do you persuade people who are so entrenched against the vaccine? Have you ever managed to persuade any of them to change their mind?
Well, some of us, my family members, and I only do them as experience. When the recent one was my auntie in Vegas was in the hospital for 3 months. She went in there for a procedure, then she got the virus, and she was on a ventilator for 3 months, still on an oxygen machine. I had my nephews who recently, mostly all of them was vaccinated, and they're all in their 20s and early 30s. And the one that wasn't vaccinated ended up in Queens Hospital. He recovered and recovering slowly. But the ones that had the vaccination, within 3 days, it was okay. No fever, no running nose, no nothing. So that's the thing that I share with the community in Ever Beach all the way to Waianae when I'm in a vaccine truck or the bus. I just share my experience that I had family members who didn't and got really sick, and family members who did and didn't get real sick. And that's the only thing I can tell them, because stop reading social media and stop believing other people, because they're not doctors and health professionals. They're just YouTube video fanatics and making people scared. And I don't want a YouTube doctor doing any surgery on me.
Okay,
So these
Senator.
are the things that we need to make sure that our community know.
Okay,
It's serious.
Yeah, I
You're
think,
losing.
Senator, I think it's a very good point that a lot of people are repeating personal stories they've heard and not relying on science. What you're saying is I take my personal story and turn it the other way. Monique Chiba, you wanted to toss in something here.
Yeah, I wanted to mention that what the model was very clear is that without the vaccination, the only way to deal with the Delta would have been through very severe lockdown that would last for a long time. That was the only mitigation that would have addressed the Delta variant if we didn't have vaccination at the time. And the less vaccinated people, the more severe we have to do the mitigation in order to address the issue. And this comes very clear through the model.
Okay, so I've started to get quite a few questions here, and I want to honor our audience for their questions. This is always something that comes up. I hear this often, and for Hilton and Kenny, Miles in Hawaii asks, of the vaccinated patients who need ventilators, what percentage have underlying conditions? Can the DOH publicize this? And we don't have anybody from the DOH on our panel, but Hilton, let me start with you. Do you know how many of the people who are vaccinated who end up on ventilators, that is this small number, have an underlying condition that puts them in that position?
Well, it's certainly true that if you are elderly or frail or of underlying conditions, even if you're fully vaccinated, you're still at a higher risk if you do get infected, if you're a so-called breakthrough case. So yeah, we are seeing that. It is true that we are seeing people with underlying conditions. And as Kenny said, their bodies aren't as strong. And whether it's because they're old, whether it's because, and when we're talking about old, I'm talking about 80-year-olds, 90-year-olds, or whether you have underlying conditions, or if you have compromised immune system, then your body doesn't have the same defense mechanisms that it does have for all that other people have. But there is a marked difference between those who are vaccinated and end up in hospital and those who are not. Overwhelmingly, the people who are vaccinated and end up in hospital, and it's only a small number, they may be in for 3, 4, 5 days and generally at a much lower level of care. And then they recover and they go home. Whereas the people who are unvaccinated, they can be in for 2 weeks, 3 weeks, 4 weeks, or even longer. There's a very, very distinct difference between the hospitalization of a vaccinated versus an unvaccinated individual.
You know, Kenny, when you deal with these patients, you're a crisis nurse. So are you mostly dealing with them at the most dire moments, as opposed to when they're first checking into the hospital? I'm kind of curious as to what you've seen across the board in this. Are the vaccinated patients, what happens to them generally when they come into the hospital?
The vaccinated patients, well, it's hard because I don't see much vaccinated patients. It's like maybe I can count the vaccinated patients with one hand, maybe a couple. It's usually the unvaccinated patients, and of course they're usually sicker. So, and it's true that I usually see the sickest of the sick, usually right before we put in them on the ventilator.
So I'm going to, Monique Chiba, did we see a Labor Day increase? Did we see a bump from Labor Day in terms of our numbers? The question is, are we past the Labor Day weekend potential increase? We've already talked a little bit about underlying issues, but did we get a bump from Labor Day? It seemed like to me people were not out very much on Labor Day.
And it's not just that, but there was also a decrease in traveling. And we had also the safe access coming right behind, and we had the ban on gathering. So there was a lot of restriction that would counteract the Labor Day. So I don't expect as of now to see a big surge that I would attribute to the Labor Day.
You know, I want to take the second half of this question also, Hilton, if you wouldn't mind, how much does underlying issues play in the recovery and potential for survival? I think that there's a sense that, oh, if I'm a healthy person and I've managed to remain fit, that I've got a much better chance of survival, and that a lot of the people who've died, I mean, when you see the health department saying it's underlying conditions, underlying conditions, underlying conditions, I'm wondering if that gives a false sense of security to where people are generally fit.
Absolutely, it does. We have seen individuals in Hawaii and across the nation who are very fit, no underlying conditions, no prior health history of any significance, and yet they can still die. Now, it's not a lot of individuals, but it's not a free pass. Just the fact that you're healthy, you take care of yourself, you eat well, that does not give you a free pass when you're talking about COVID. COVID does not discriminate. The Delta variant does not discriminate.
Kurt Favela, I'm wondering, what is that a misconception in the community, that somehow if you're healthier and you're not obese or you don't have asthma, that you're going to be fine? Is that what you hear?
Well, especially in the younger generation, because they exercise, they eat right, they go to the gym, they stay away from crowds, they wear their masks, so they think that there's no need for getting the vaccine, and I try to explain that that's not true. When it hit you, in the beginning we had a lot of community members that was very healthy and young, and got very, very sick, and using oxygen tanks today. So it's very serious that they realize they're not invincible, and the virus don't have any prejudice against anybody that does.
Monique Chiba, as a epidemiologist, also, what trends have you seen in the ages of the people who test positive now?
I just want to clarify, I have no background in epidemiology. I work with epidemiologists in HIPAM, but I'm just a mathematician. So I just have access to the public data. I don't have access to any specific granular data that gives the age of the people. But what can I say? Because I work at UH, and we had the vaccine mandate, and we've done some simulations that would show what would have happened if the UH students would go through a 60% vaccine rate rather than a 95% rate, and it would have impacted negatively quite significantly the state.
One thing I would like to ask, though, have you been satisfied by the data that's being generated in Hawaii by, that's available to folks like you in analyzing independently what's going on? I mean, is the state generating enough data for you to really do all you want to do in terms of trying to predict what's going on?
This is a very, very difficult question, because the word got cut by the pandemic without expecting it. So I don't think anybody knew what type of data we needed. There are a lot of data that are coming out. We would need a more granular level, of course, in order to do the modeling. There is a lot of information that we don't have about, like, the length of the people in the hospital or the age of the people in the hospital. We don't have access to that. So the model sort of finds that there are shifts in hospitalization ratio, but at the same time, and that's what we're working now as modeler, we're trying to understand what are the data that they need to provide us, so that then we can have a proper data protocol. I think you hit a very, very important question that is in development.
A couple of questions have come in, and I think these are probably for you, Hilton. Actually, this is a kind of a hard thing. Someone wants, John via Facebook, please explain in a nutshell the new technology with the vaccine. I think that a lot of people think that there's something new and kind of scary about this vaccine. Is there anything new or different or about this vaccine that differentiates it from other vaccines that people are more comfortable with?
Well, I'm not an immunologist, but having read quite a bit about these vaccines, these vaccines, the technology has been around for quite a while now. How they were developed is, they were developed over a relatively short period of time, which is true, but there was a huge amount of time and effort and money that was put into the development of these vaccines, much more so than there would be normally for vaccines. You don't have that same sense of urgency. And so what people need to understand is that all of the necessary stages for the development and testing of these vaccines, the manufacturers had to go through. So they may have done some of those, there may be some overlap between some of the stages because of the urgency, again, of the situation, but they had to follow all the protocols and all the requirements that any other vaccine manufacturer has to go through. So there was no shortcuts taken in the development of these vaccines. And in terms of how many have been administered and how safe they are, we're incredibly fortunate that these vaccines are as effective and as safe as they are.
Kurt Favela, let me ask you this real quickly. Do you get a lot of people who say, "Oh, I don't want you to put something experimental in my body"?
All the time. I mean, they're saying that, and the sad part about it is that we have a lot of other family members that have certain other underlying diseases that they do drugs that is not been on the market long time, but it's all about choices. If you want to debate and put your life on the line, it's hard to say. They say it's your choice, your body, but then you're in the hospital, cannot breathe, and then now the decision you want to take it is too late. You know what I mean? So, you're gonna turn to a zombie. It's gonna make your DNA change. You're gonna be labeled. You're taking the mark of the beast. There's all of these things that is being said. But if I can trust in the science and trust in the data within my family, to have my mom, my daughter, my wife, and my dad, my family to take it, and it's proven. My daughter had no symptoms, when I took the Moderna, it was a little bit different because that's the only one we had at the Capitol at the time. But the Pfizer is really great. My wife and my daughter took it, and my dad, and no pain, no bruising, no nothing. So I just really kind of trust in the data of what's being put out there, and then that's the only thing that I share with the community. That is a proven fact within my family.
So
we go forward to keep our family safe.
Thanks, Senator. And then again, back to you, Hilton. This distinction, someone asks, from Mel and Kakako, why hasn't the media mentioned that the Pfizer vaccine is the only one approved by the FDA? There's a lot of different levels of approval. Should anyone be concerned about that? About one vaccine being better than the other, or one being approved and one not?
Well, it's really the amount of time that we've had to actually review the findings. And so for the vaccines that have received emergency use authorization, which in the US is Johnson & Johnson and Moderna, they have shorter periods of time. They have received emergency use authorization, but they've not received the same amount of time in terms of following up the results after the vaccine that the Pfizer did. So Pfizer had more data faster than the other two vaccine manufacturers. Now, Pfizer does now have full FDA authorization for individuals 16 and above. The Moderna and Johnson & Johnson vaccines are still operating under emergency use authorization, although they will be applying or have applied for full FDA approval. Just going back to the point about that you're talking about the drugs and being experimental. What is fascinating here is that the Pfizer vaccine has received full FDA approval, and people are still concerned about taking that, still calling it experimental. And yet, as the senator said, when they end up in the hospital, one of the most effective treatments we have is remdesivir, which is administered in a hospital setting, which is under a emergency use authorization that has not yet received full FDA approval. And yet, I do not know of a single instance of someone who's in hospital who's turned back the remdesivir as a treatment because it's under emergency use authorization. Once they get that sick, they say, "Give me whatever it takes. I don't want to die. I want to get well." So they've rejected a vaccine, which is full FDA approval, and yet they get treated by remdesivir, which is approved under emergency use authorization.
I think one of the things that I noticed, I think this was New York Times reported, that a dose of treatment by remdesivir or by these monoclonal antibodies costs about $2,000 per patient, paid for by the federal government, which is basically us, while as a vaccine costs like $20. So thank you, all of you guys jumping in remdesivir for spending my money. Kenny Akamu, what's been your experience at the hospital level with people who are vaccinated, unvaccinated? What kind of things do they say when you tell them, there's not much we can do for you except we got to basically play this out? Isn't that basically what you have? Or are you able to treat them, and what kind of things do they ask for that you can't give them?
Well, some people actually ask for the vaccine after they're really sick. They thought that they had the option of getting the vaccine, and that is totally false. The only time you can get the vaccine is when you're healthy, so that your body is healthy enough to produce the antibodies. So some of them is really surprised that, oh, wow, can I get the vaccine now? Yeah, too late. So yeah, that is one of the misconceptions that needs to be cleared. And also, getting back to that experimental part, I think isn't there like 182 million people who already got the vaccine in the whole United States alone? And everything, all of the data has been collected with 182 million people. So you should never ever use experimental as an excuse. No way.
Let me throw out this. I've got several questions now about the crisis of care plan. Now, Hilton, fairly recently, as recently as 3 or 4 weeks ago, we were looking at peaks of the hospitalizations and ventilator usage and so much in hospitals that were at a near crisis level. That is, you almost were in a place where rationing of care might be necessary. And this is what this crisis of care plan is about. Can you describe it and comment a little bit about the concern about the age as a tiebreaker for something like that? Could you explain that to the general public, why you would need this kind of triaging of care, rationing of care is the term that's often used? Why would you need it, and how would age fit into the equation?
So we were very, very fortunate that we never got to the point in the state of Hawaii where we had to enact the crisis standards of care framework. And that's a terrible place to put doctors and nurses and other healthcare professionals in, where they have to make decisions about who does and does not get care. So again, we're very, very fortunate we did not get there. Idaho, for example, they are operating right now, the whole state of Idaho, under crisis standards of care. So they're having to make those decisions every single day. So but the crisis standards of care framework is a framework for saying, if you literally run out of resources, whether it's oxygen, whether it's ventilators, whether it's beds, whether it's staff, whatever it is, how do you allocate resources, scant resources? Now, there was a huge amount of work done about a year ago by a very dedicated group of physician leaders in the community, and they put that document together, working with the Department of Health and the Healthcare Association the Healthcare Association of Hawaii. Now, that document is undergoing revision because it's a living document. So it was written at a point 12 months ago, before we had vaccines, for example, and with the information we had at the time. It is currently undergoing edits right now. There will be a new version of the document coming out. Now, going back to age, the age is a factor in any medical decision, because if you are older, then there is especially, depending on, as you talk about getting much older, then your body doesn't have the same ability to fight disease as it does, as maybe a younger person does in general. Now, you can have a very healthy 80-year-old and a very unhealthy 50-year-old, for example. So all of those factors are taken into consideration. But we do understand that when that document was put together, the age was put in there, that those particular sections are being looked at, they're being reevaluated right now. And there will be a new version of that document coming out that that is, what we don't want this age tiebreaker concern to be a detractor from the fact that there should be a process, there should be a legitimate process. And so again, there will be an updated version of that crisis standards of care document that is coming out very soon. And again, fortunately, we are able to bring in enough resources into the state in terms of oxygen, in terms of staff, to avert what has happened in other parts of the country.
Kenny Akamo, let me ask you, have you ever been in a position where you had to make a decision like that? That is, I've got one vent, I've got two patients, and then how did you deal with it?
We always try to improvise. The person who already is on the vent, we ain't gonna pull nobody off of a vent. We'll figure it out somehow. We'll either bag them with oxygen or we'll transfer them to another hospital. We'll find some way to take care of the patient. We would never pull treatment away from another patient to treat the other patient. We'll figure something out.
Can you describe to me what it's like for the patient and even for the caregiver when a person gets to the point where they need, and we keep saying vent, it's ventilator, which is essentially a forced breathing device, right? So what's it like at that point? How do you decide whether someone should be ventilated or not? And what's it like when you have to do that?
I tell you, the patient has suffered a whole bunch, a whole lot before we even get to the ventilator question. They've been suffering and they've been short of breath and they've been desaturated, and we've been doing everything we can to pump oxygen into the patient's body so that we can adequately oxygenate them. A lot of times we got this really high flow oxygen, we're blowing up to 60 liters of oxygen through their nose, trying to oxygenate them. And we're constantly trying to encourage them to lie on their stomachs, because that helps. We learned that because of the anatomy, it oxygenates them better. We're doing everything we possibly can. And when there is absolutely no choice, when it comes to the point where, it's a good chance that the patient can't die because we cannot get any more oxygen to them, and then we would decide on putting them on the ventilator. So when you see all of those patients on the ventilator, those patients would have probably died if not for the ventilator.
And also, you are also at that point forced to put them under, right? I mean, you can't be really conscious while you're on a ventilator, isn't that true?
Right. So we'll give them adequate sedation, and we'll keep them on a ventilator sedated and try to keep them as comfortable as possible. But at a certain point, we do everything we possibly can. We'll adjust the ventilator, the different IE ratios, we'll increase the speed, we'll do everything we can, but at a certain point, you're on 100%. Everything you're doing cannot work, and at those stages, we might have to that's the last step we will do, paralyze the patient. And then we might keep them paralyzed and in a deep medical coma for as long as we can, sometimes days. But when they're in a deep medical coma, you've got this system, it's called a bispectral, it's like an EEG for the brain, and we kind of hope that the patient's well sedated. But of course, they become tolerant of the sedation, and then sometimes they might wake up and you try to give them more sedation, and well,
it's just sad. It's basically out of touch. Let me move on to a couple of questions we've gotten about mitigation, and I think Monique Chiba and Senator would be best to talk about this. Should the unvaccinated be banned from air travel? Monique Chiba, what effect do you think that would have on our spread rates and stuff?
Yeah, that's a good question. There was this week some news about the fact that the testing might not detect as much or filter as many people that are unvaccinated. That was for unvaccinated travelers, and then that it can be as low as 20%. So it is something to keep in mind. But again, that was the study was for unvaccinated people, and most of the travelers are vaccinated right now, I think.
What about the effect of reinstituting testing in the same light, Dr. Chiba? would that make a difference, or again, is there too much leaking through? And then from the big picture, is travel affecting our rates here?
It didn't come out. We canceled tourism. Like when you have a model, you can virtually do whatever you want, right? Whatever experiment or scenario you want. So you can shut down tourism, and so you still have residents traveling. There is a lot that came through the resident, and then it gets rooted into the community, and this has been the main source of the spread.
The travel, people going to the mainland and bringing it back as individual travelers, as I recall, a quick trip to the mainland and back, you're totally not going to get caught by a test for 72 hours before you travel. I mean, the chances of you getting caught in that test are pretty small, right?
Yeah, I don't have the exact data about that.
Senator Favela, talk about the politics behind these travel bans and stuff. What's your feeling about it? Do you feel like we're too open right now, or do you feel like we should open up more? Where do you stand on that, and what kind of discussions are going on at the Capitol about that kind of stuff? I think you're muted, Senator. I think you're muted. Try check. I think we've lost your audio. Let me try that question for Hilton Rathel. What kind of big mitigation do you think is still ahead?
I know.
Oh, here it comes. Senator, can you start again? My question to you is, what kind of discussions are happening at the Capitol about particularly travel?
Bottom line is, for travel, we wanted to go back, as our colleagues talking in the coronavirus committee, we want to go back to the tier system. The tier system would give a better prospect on how traveling would be. And if we have to have the vaccine and mandate the vaccine for every single person coming in or going out for travel to keep our families safe, I think that would be a good recommendation. But we got to go back to the tier system to give the people of Hawaii, knowing what is the restrictions and what can happen if we reach a certain tier. But right now, we don't have that.
You know, that question just came up just the other day when the city and county decided to sort of drop tier system. Tiers being this many cases we do this many cases we do this many cases we do this, or this many hospital beds, into sort of a more holistic look at all the different factors and make a decision. It sounds like you're saying that you're somewhat uncomfortable with that position. You'd rather see firm numbers, and why is that?
Because we can at least let the community know where we're at before we go to a total shutdown, and be more careful and be more vigilant in knowing that we're in a certain area. And we don't need the mayor or the governor to do this. The Department of Health has the power under a pandemic to inquire and do their own tier system. They don't need the neighbor island mayors or the governor to do this. They can do it themselves on the power of the pandemic under that order to go ahead and implement any of that kind of tier system. We don't need the mayor or the governor. They can do it because they have the data and they have the power. But to push that power, they don't want to pull a trigger. And somebody needs to pull a trigger to keep our families safe in Hawaii. Somebody needs to take the leadership and do it. That's the only way we're going to have the community know. When we had that tier system, to think about it back when we had it, everything was, I'm not saying better, but it wasn't as worse as it is now. Open range. Okay, nobody knows what's happening day to day.
Let me Hilton Raphael, on the travel issue. We have heard recently that there may be more travel related that we're not catching because people who come from the mainland don't generally get tested here, or even when they get home, unless they get sick. Is there still confidence in the medical community that the number of travelers coming is not really having a big effect on our case counts and the spread of the disease here?
Well, what we're most familiar with is what's happening in our hospitals, and we do track how many of these travelers end up in our hospitals, and that's what we're most concerned about with this disease, is how many people actually end up really sick. And what we're seeing overwhelmingly, and we've seen this since the vaccinations have been in effect, that the travelers are not the ones who are bringing the vaccine bringing the virus into the state. Now, that does happen on a small number of occasions, but when we look at our hospitalizations, the tourists that are coming from the mainland, because it's predominantly US tourists that are coming in right now, we only end up with a very, very small proportion of those in our hospitals. What we are seeing more of, and certainly probably 95% of our hospitalizations are either locals and through local spread, or it's our own residents who go to the mainland, go to the Vegas, go to other states, they're not careful, or they just inadvertently do get infected, and they come back and then they spread it. So it is not the tourists, it's a very, very small number of tourists who end up sick in our hospitals because of COVID.
Ken, I'm going to change the subject a little bit because this is an interesting question. We've been talking so much about the people who get very sick, and obviously those are the people you deal with for the most part, but you're also in this community. I'm sure as a nurse you get lots of questions from people. You're probably aware of many people who have gotten infected who maybe didn't end up in the hospital. The question is, talk about COVID in young adults. I think that we've talked so much about the dire cases. What happens when younger people get it and maybe don't end up in the hospital? I don't, Kenny, are you familiar enough to talk about that?
Remember, I mean, a lot of us got really, really, really sick from the flu, but we never did end up in the hospital. So just the fact that these people are in the hospital, it means it's pretty bad. And that's not even mentioning the thousands of people who get sick who don't even get to the hospital. And I mean, it's a plain fact that getting the vaccine is going to make you less sick. So you get the vaccine, you're sick for maybe 1-2 days. You don't get the vaccine, you're sick for maybe 6 days. There's 4-day difference where you can actually spread the disease. It's a big difference. Just during that 4 days, you cough on one immunocompromised person, an old person, make them sick, make them die. I mean, I think it's everybody's responsibility to just get the vaccine. Just get the vaccine. You might prevent somebody from dying. Isn't that a good enough reason to get the vaccine? Two shots.
Yeah, I understand what you're saying, and that we talk about, if we talk about a lot about people who don't get really sick, it makes it sound like it's not that serious, but in fact, you can very easily get somebody else sick for whom it would be very, very serious. A couple other questions we've got.
And a lot of people,
Go ahead.
a lot of people are very, very sick, and they don't even go to the hospital. We don't even talk about that population.
Do you see them come into emergency rooms? Is that what happens? The people
Some
who
of
get,
them drive in, and some of them come to the emergency. A lot of them get brought in from the city and county, the EMS, and again, if they get sick, unvaccinated, they're spreading it to all of the EMS workers, spreading it to the ER workers, the hospital workers. I mean, right there, I mean, that these unvaccinated people are spreading it to more people. Just the fact that they're not only at home, they're coming all the way to the hospital and spreading it to everybody else.
Hilton, we got another question from someone who says that they looked it up and actually remdesivir is approved by the FDA, but is that on an emergency basis similar to what the vaccines are approved for?
Yeah, let me just double check on that real quick. I know it was approved under emergency use authorization when we first started using it. So that's, and when we did first start using it, it was taken by patients who were unvaccinated. They're very happy to be treated by remdesivir, even though it was operating under emergency use authorization back then.
Yeah, I mean, as of yesterday, when we were doing stories about it, I was hearing that it was still emergency approval. Okay, a question from someone who just has a basic question. What exactly is in the vaccine? My friend said it has baby placenta in it. Does it? From what I understand, no. But does anybody on the panel have that information, Hilton? I mean, no.
Again, I'm not an immunologist. I'm not a scientist. So I'm not qualified to. But
okay, so what is it, Hilton? What is the status of some of these? And maybe Kenny, you want to weigh in on this too. This ivermectin thing. Now, today we learned of a lawsuit by someone. It's a New York lawyer who goes around the country making these same lawsuits, who is suing to try and force one of our big hospitals to give a patient ivermectin. What's going on with that? Is that a good idea? And how do the hospitals feel about being forced to try unapproved therapies? Hilton?
Sorry, I was just looking up that question.
Same question I emailed you this afternoon. About the
okay. Yeah, we're not supportive of that drug or other drugs that have not been used in clinical trials. Now there are drugs that are used in clinical trials under very controlled circumstances and very strict protocols as to how they're used, but that's not how this particular drug is being used. And so, no, we're not supportive of that drug being used for the treatment of remdesivir. There's no clinical evidence at this point in time that it does work. But to the contrary, there's actually a lot of evidence that it has very significant and profound side effects.
You know, one of the big things, and I'll start with Senator Favela on this question, is, our kids are back in school. The kids up till 12 cannot be vaccinated. Even the ones that are older than 12, maybe half of them are vaccinated. Senator Favela, are you confident that it's safe for kids to be in school, not just for them, but for the whole community? And I know you guys have been asking DOE and Health Department about this.
I really feel like the ones that don't have the option to get the vaccine should be more, be more aware of not having an option to have distance learning. But the reason why I changed a little bit on why kids should be in school, I just use my school in my district, Campbell, as an example. We have fights. We've been having fights mostly every day. Some of these kids never ever been on a high school campus or been in school for almost 2 years. So the social attitude and social skills that they usually have by bonding, and I'll be the last person to bring this up because I was totally against my daughter going back to school, even though she had the vaccine, because of the high risk of endangering our teachers, faculty, and staff. But it's more so of a psychological thing for the well-being of the kids interacting with other kids instead of not having that interaction. Is really being 50-50 chance of doing even more harm than good in going forward. And I really feel for the family and friends that don't want their kids going to school, because our Campbell High School is one of the highest in testing and having positive results. But in the long run, I think our kids will suffer more psychologically if they don't be able to have a school environment. And believe me, you can ask my colleagues, I was one of the hardest pushing to have no kids go back to school. But when I seen firsthand what happens when you don't have these social skills and understanding the authority of an officer that has a gun and a badge, and you just keep on going like they're not even there, a society is going in the wrong direction.
Okay, Senator Monique Chiba, you had something you wanted to pitch in there. I am curious as to whether you've modeled the impact of school attendance into the case counts.
Well, we cannot model them because we don't have data. There is no data that is telling us, like, for instance, the age of the person, of the people in the daily cases. We have almost no data on that age group 0 to 11 that is unvaccinated. However, there are data supporting the fact that the transmission is very reduced in the elementary school, and the kids that are sick and that test positive, the transmission likely occurred outside the school environment at that age, because they're younger. So I don't know if it's the viral load that is smaller, but that has been a trend that has been observed. So that's what I wanted to pitch in.
So in other words, you can be in school. In fact, it might be safer to be in school than it is to be out in the community?
Yeah, I wouldn't go that far about saying something like that, but there is data supporting the fact that the school are not a huge, at the elementary age, are not a huge vehicle for transmission in between the children.
Hilton Raytha, what have you been seeing when it comes to very young transmission, very young people going into hospitals?
We're very fortunate in Hawaii to have not seen any significant numbers of pediatric cases or COVID cases in children. We do have some, and certainly in some other states. It's interesting that the states that have the most children that are hospitalized are the states with the low vaccination rate. So there's a very high correlation there, which you would expect. So if you've got a low vaccination rate in the community, then more kids are going to get it. And so therefore more kids are going to get up in hospital. But yesterday, for example, if I recall the numbers correctly, we had 2 pediatric patients in the state, or 2 pediatric patients in our intensive care unit in the state, pediatric intensive care unit, or PICU, with COVID. And that's a very, very small number. And so as we track those numbers every day, it's very, very small cases.
Hilton, I'm sorry, we have just run out of time. So I've got to say mahalo to all of you in our audience for joining us tonight. And we thank our guests, Republican State Senator Kurt Favela, President and CEO of the Healthcare Association, Hilton Raytha, UH Professor of Mathematics, Monique Chiba, and crisis nurse, Kenny Akamu. Once again, thank you for your service, Kenny. Next week on Insights, Hawaii's transgender community. We'll discuss everything from discrimination and prejudice to the push for better health care and legal rights. Please join us then. I'm Daryl Huff for Insights on PBS Hawaii. Aloha.